Chapter 1: Understanding Transgender Identity. What is transgenderism? To fully grasp the essence of transgenderism, it is essential to distinguish between sex and gender. Sex is typically assigned at birth, based on physical characteristics such as genitalia and chromosomes, categorizing individuals as male or female. In contrast, gender is a social construct that encompasses a spectrum of identities and roles that can vary widely across different cultures and historical periods. Gender identity, therefore, is not solely determined by physical attributes, but is deeply rooted in an individual's psychological and emotional self-perception. This distinction underscores the legitimacy of transgender identities, as they are based on an internal sense of self, rather than purely biological determinants. The recognition and acceptance of transgender identities have evolved significantly over the past few decades. Historically, transgender individuals were often marginalized and misunderstood, with their identities pathologized or dismissed as deviant. However, advancements in social justice movements, increased visibility of transgender people in media and public life, and growing academic research have contributed to a more nuanced understanding of transgenderism. This shift towards acceptance is reflected in the increasing recognition of transgender rights and the growing support for inclusive policies and practices. Despite these positive changes, transgender individuals continue to face significant challenges, including discrimination, lack of access to appropriate healthcare, and social stigma. One of the key aspects of understanding transgenderism is acknowledging the diversity within the transgender community. Transgender identities are not monolithic. They encompass a range of experiences, including those of transgender men, transgender women, non-binary individuals, genderqueer people, and many others. Each of these identities represents a unique way of experiencing and expressing gender, highlighting the importance of recognizing and respecting individual differences. This diversity also underscores the need for inclusive and flexible approaches in healthcare, legal systems, and social support structures to effectively address the varied needs of transgender individuals. The psychological and emotional aspects of transgender identity are critical components of understanding transgenderism. For many transgender individuals, the journey towards self-acceptance and affirmation involves navigating significant internal and external challenges. Gender dysphoria, a condition characterized by distress resulting from a mismatch between one's gender identity and assigned sex, is a common experience among transgender people. This
Sample complete. Ready to continue?